Welcome, viewers. Thanks to Allah subhanahu wa ta'ala that you all encourage us with your support in the path of the choice and to serve humanity. Of course, we are all deeply grateful to Professor Dr. Anthony Leeds for this difficult research, for guiding us on this important topic to save human life. As you all know, that Professor Dr. Anthony Leeds is the world's renowned personality based on his expert research and experience on diabetes, and the large number of people in the world are suffering from this disease, which is called in common language as silent killer. Diabetic patients also have to face other life-threatening disease to avoid which Professor Dr. Anthony Leeds has had a very useful discussion with various experts of the world to cure these diseases, which millions of the people are benefiting from. In this regard, I am once again grateful to Professor Dr. Anthony Leeds for taking time out for us, where we will ask him about his noble program of humanitarian resources and what is his next program. Professor Dr. Anthony Leeds, welcome you in the behalf of EOS, Bit and Truth, and all the viewers around the world, which are well over more than 4 million according to our record. My first question to you is, sir, what are your main impression from doing this series of health chats, please?
Well, first of all, thank you for inviting me to talk to you. But I think the most interesting thing that I've seen is that there are so many people who are interested in the topics that we've been discussing. And as a consequence, we have a very large, loyal audience. And you referred just now to a figure of 4 million individuals. You've gradually managed to grow the audience. And I'm very grateful to your team who work to send out information in advance of the programs to inform people about what will become available. And the consequence of that is that we have a very large number of very loyal viewers and listeners. And so, first of all, if I can express my appreciation to all of you for watching the programs, and we do our best to try to deliver a conversation which is interesting and which has useful information. And as is always the case, I provide some written text underneath the video and some web links to other useful sites on different sites for different countries. So that's really probably the most interesting thing that I've seen, is there is just so much interest. And this is not surprising when you consider the very large numbers of people around the world who are affected either directly themselves, or they have immediate relatives who are affected by these conditions. And you mentioned diabetes, and of course that is one of the major life-threatening and quality of life-threatening conditions that is affecting many, many people around the world. Numbers of individuals are measured in hundreds of millions, and we have some very good treatments. But of course, treatment is, as it were, the second option. What we would like to do, of course, is prevent it. So that's the first thing that I've noticed, is the tremendous interest. And then secondly, as a consequence of talking to my colleagues, I've clarified some ideas in relation to what we should be doing next. And in relation to, for example, diabetes, we now have information from the United Kingdom that we have a program which can be rolled out and actually delivered to individuals in order to achieve diabetes remission. And this is going to be rolled out in other countries. But what is interesting, of course, is this is relating to the effect of weight on the metabolism and in turn affecting diabetes. And that same process of helping people to reduce weight can be applied to other conditions, such as osteoarthritis. And I do know from the work we've done in Copenhagen and also here in the United Kingdom that it would be possible to deliver that type of program in the United Kingdom and other countries for the benefit of people who suffer from osteoarthritis.
If you could do just one more program of work in the UK, what would you do?
Well, I think that I would like to see the development of a program for osteoarthritis, which is like the one that we now have for diabetes remission. Now, obviously, it takes time. It takes time from the period of the development of the good quality scientific clinical trial evidence through to developing a program which can actually be delivered in practice, because there are lots of quite complex practical solutions to develop along the way. And it has to be cost effective as well as actually working in terms of the changes in the health of the people who receive it. And that does take a few years to establish and show that it's working. But I think that with regard to osteoarthritis, we do know what the underlying mechanisms are to some extent. We know that losing 10 or 15 kilograms with osteoarthritis does reduce pain. I know from my own practice and from the clinical trial results that reducing the pain enables people to sleep better, and as a consequence, they just feel better, and they are dramatically improved as a result of weight loss. Now, in the UK, as a consequence of the COVID pandemic, we have a large number of people waiting a very long time for knee and hip surgery. We've done a preliminary feasibility trial based in Edinburgh and in Leeds, looking at a combination of a weight loss program with knee exercises, optimization of analgesia, and the use of orthotics and weight loss using the Formula Diet program, and have shown that that is a feasible program. There's really no reason as to why we shouldn't be able to roll that out fairly quickly, rather than have to go through another 5-year period of a multi-center trial. So I'm hoping that I can persuade the right people to consider implementing that kind of program. So that would be my next program for the United Kingdom.
One similar question: if you could do just one program in South Asia, what would you do then?
Well, I think that we have to bear in mind that South Asia is affected by diabetes, and the different countries of South Asia have different prevalence rates for diabetes and varying ability to deliver the services that are necessary for helping people with diabetes. And the experimental work has been done both in the UK and the Middle East, and also in other countries around the world, that shows that all people, regardless of their ethnicity and their country of origin, are able to lose weight if they use the type of program that we've recently used in the UK and in the Middle East. And using that type of program, it's possible to lose enough weight to actually put people into what we call remission, which is where the diabetes is no longer present. In other words, you make the blood measurements and so on, and the diabetes is not there. Of course, you've then got to maintain that state, and that is perhaps a little bit more challenging, but we know how to help people do that as well. So we would be able to apply that in South Asia, and I would like to see a diabetes remission program started on a small basis initially, to demonstrate within Pakistan that it's possible to deliver the same type of program to a population within Pakistan. Pakistan, as you know, has a very high rate for diabetes, and it is going to mean that there will be a very high cost in terms of deterioration of health and development of the complications of diabetes, but there will also be increasing health costs, and also serious chronic diseases have an impact on the economy as well, because they have an effect on the workforce and cause the workforce to be less able to work. So it's really quite important to try to prevent diseases like diabetes. We know how to do that as well. And then also, once they've actually been diagnosed, to put them into remission.
We have heard a lot in this series about eye health and brain health, especially the dementia. In the last episode, part 2, actually, you see dramatically, actually, the very large number of our viewers, actually, more than 4 million people actually visit that video, actually. So what needs to be done next in these two areas, actually?
Well, as you know, with regard to eye health, I spoke with colleagues in Waterford in the Republic of Ireland. And if we begin with eye health, and the condition that we discussed was age-related macular degeneration, which is a condition that affects people, older people, mostly, occasionally starting a little bit earlier. But we have a lot of information about the causes, and some of them we can't address. There's an aging effect, particularly, but there are also some genetic factors which we're beginning to understand. But there are also a lot of diet and lifestyle interventions that can be applied. And the particular point that was discussed by my colleague John Nolan from Waterford in Ireland was that the eye is a very important location within the body where coloured pigments play an important role in protecting the eye from damage from light. Now, many people would think, well, that's very odd. How come the light does damage? It's the blue light mainly which causes the problem. And excessive blue light will cause damage within the back of the eye. And protection from this effect is achieved by having sufficient of those yellow pigments present there. We can't synthesize them in the body. We cannot make them in the body. It's necessary to actually eat them in the diet. And with an adequate intake within the diet, then the eye would be adequately protected. However, we do know that the typical diets that are consumed now in the Western world, and even in other parts of the world, do not provide sufficient of these pigments. So the experimental work that was done was to develop a preparation by extracting these pigments from marigold flowers, and then concentrating them, putting them into a tablet preparation and providing them as a supplement. The experimental work has shown that using that type of supplement has actually enabled people with the early stages of this condition to benefit with improvement in the quality of the vision, and also to slow the disease down. Now, this is still at a relatively early stage, and I do know from conversations with John Nolan that what he would like to do is to do a multi-center trial based on a number of different countries around the world. This would be an extremely expensive study to do, but it would tend to consolidate the evidence because, as you know, you generally have some difficulty introducing a new intervention or a new treatment, even if it's a straightforward dietary treatment, without having sufficient experimental evidence. And so we would like to find the resources, and are of course trying to find the resources, to fund a very large multi-centre trial. It will cost millions and millions of pounds, but the consequence of having good results from that will be that eventually we would save, A, the sight of people who have this condition, but B, also the consequences of it, which is gradual loss of high quality vision, is a serious factor for those who are affected by it, and we would be able to address that. And then with regard to dementia, now the evidence in relation to dementia is at an earlier stage, and there's a need for more work there, I think, and so it's again exactly the same thing going on to a much larger scale, much longer duration study with the collection of more information. So I think it will be a number of years, but as was pointed out by the physician who discussed this, in terms of what we can do, there are again lots of lifestyle interventions that are possible for people with dementia. Early detection is important, early intervention, particularly in relation to those things that can be done to actually protect the brain, like avoiding head injury, and making sure that people don't smoke tobacco, limit their intake of alcohol, and also again follow a good quality diet. Yeah, and of course there are drugs, there are medications which can be used. They are effective. There's good clinical trial, but those are aimed really at the stage when the condition is known, identified, and is perhaps a little bit more advanced. But they have been proven to be effective. But the problem is they are relatively expensive, and the reality therefore is that they will not be available for everybody across the entire globe. And so we must introduce those other diet and lifestyle measures. And if it becomes clear and appropriate that you can use the same supplements for dementia as for the eye disease, age-related macular degeneration, then to use those. But more work needs to be done before that can really be thoroughly and confidently introduced.
Professor, actually, a very important question which I'm going to ask you now. I mean, good quality scientific research is very expensive. So far, actually, you are retired, but you are very kind. Actually, you spend a lot of time with us, actually, and for our request, and you're doing a very good service for the humanity. Are you looking for more funding for that?
I've been looking for funding for research for various research units in different parts of the world for a very long time. I've helped people to have a degree of success in raising funding for all the work that's been going on for 15, 20 years. Of course, there are many other people who do the same thing. In fact, all academics spend large parts of their lives trying to raise funding from different sources. And I think the true position is that there is not enough funding. But I think that when you get to a stage with various disease processes, and having shown it with a certain amount of evidence that you can actually do something that's really good, like the position we are in with diabetes remission at the present time, it makes sense for something like that to be given a degree of priority. So while we have very good medications for diabetes, what's actually happening is, of course, we're tending to use them earlier than we should, because the first step, somebody with a type 2 diabetes diagnosis, the first step should be to lose weight, but that is not actually done in practice. A lot more work needs to be done. It's also very clear from some work that's published and some other work that's not yet published but is in the pipeline, that people from different backgrounds and different ethnicities are able to lose weight very effectively on the formula diet programs. The challenge really then is maintaining the diet and the weight, because in actual fact, if people are unable to maintain the weight loss, then their improved metabolic state will not continue. Further work on diabetes remission, for example, in South Asia. We also have a program that we've developed that's about to start in Malaysia, which is the country in Southeast Asia which has the highest rate for type 2 diabetes. But I'm also now very keen to help John Nolan and his colleagues in the Republic of Ireland find the funding to extend his work on age-related macular degeneration, to enable him to do a big multi-centre, multi-country clinical trial, and then also to extend that towards dementia, because dementia is going to be another of those conditions which is going to put enormous burdens on individuals, on families, and also on state healthcare. So those are the things. So the answer to your question is, yes, I'm always trying to find money. So this, in a sense, is almost an appeal for help from perhaps there are a few people among the 4 million who listen to the program, to say that if any of these areas have been of interest to you, I can put you in touch with the various universities that are working in this area, and then maybe there's a scope for some help. And we really would like to get on with this, because, you know, to drag our heels and not do it means that more people will suffer for longer unnecessarily, because when we have the knowledge, we should be able to apply it as quickly as possible. And unfortunately, the systems generally sort of cause things to slow down, but we're doing our best. So anybody who has resources.
I'm sorry that I asked this question about the funds, actually, but it's very important, actually, you know, that I know you don't need any money, but you need, of course, for the research work, that you always need some money, actually, you know, because it's very important, actually, it's what you are doing now. Then finally, will there be another series of health chats?
Well, if the people who make the decisions about doing the programs would like this to happen again, then I'm sure it'll be possible. I do have a list of guests who were unable to participate in the last series, but who are willing to participate in the next one. So maybe after a few months of rest, relaxation and deep thought, we can perhaps then come up with another series of perhaps 10 episodes covering some other topics as well. So the answer to your question is yes. If I'm invited to do it, I'm very happy to help.
All of us have a strong desire that this noble program for humanitarian service will continue, and the viewers around the world continue to benefit from you. Viewers, where we have to work hard for this entire process of bringing this program to you is the tireless research and the effort of Professor Dr. Anthony Leeds, without whom our entire work is just a dream. I'm very grateful to you once again in this regard, Professor. And you always spare some time for us, and you're doing a very good job, actually. Thank you very much. I'm very grateful, very grateful for your all kinds of services. Thank you.
My pleasure. It's my pleasure. Thank you.